Whether you're planning a vaginal delivery or a C-section, a birth plan is valuable. Even with a planned C-section, there are preferences you might have, things like seeing your baby sooner, specific drape options, or maybe even exploring ideas like vaginal seating, although that's a bit newer and sometimes debated.
It's really about identifying those areas where you have choices and making sure those choices are clearly communicated up front.
So our mission is to really unpack what a birth plan is, get into the nitty-gritty of what you can include, and explore why putting this document together is such a powerful step in, partnering with your healthcare team.
Yeah.
This is your chance to understand how you can clearly articulate your ideal scenario and work together to make it happen as much as possible.
So, at its core, a birth plan is really the document that translates your wishes for labor, delivery, and that initial postpartum care into something your medical team can quickly understand.
So it's essentially your cheat sheet for the doctors, nurses, midwives, maybe people you haven't even met before.
Precisely. It's designed to give them a clear snapshot of your preferences on a whole range of things, from pain management techniques to how you'd like the room environment to feel, the vibe.
Right, the vibe.
And even specific details about your baby's first hour or so.
I like that framing. It's not about dictating terms, but more like sharing your preferred route towards that ultimate destination. A healthy baby and a healthy you.
Exactly. It's your chosen path, and the goal is for the team to try and stick to it whenever it's safe and, feasible.
But here's the crucial first step, and this is non-negotiable.
Absolutely non-negotiable. You absolutely must understand what options are genuinely available to you where you plan to give birth.
Right, because it's not like ordering off a universal menu, is it?
Not even close.
Yeah.
What's possible varies enormously based on where you are, a big hospital, smaller birthing center, or even at home.
Okay.
And even between different hospitals, there's standard protocols, the equipment they have, staffing levels.
Yeah.
It can all be quite different.
That makes total sense. So figuring out what's actually on the menu requires some upfront legwork?
Absolutely. It means doing your research, if you can, tour the facility, ask really specific questions about their standard procedures for labor and delivery. Get a list of the pain management options they offer, both the medicated and the non-medicated ones.
Okay.
Find out what labor tools they actually have on hand, like birthing balls or peanut balls, squat bars.
Things you might want to use.
Exactly. And clarify what you're allowed to bring with you and, really importantly, what they simply cannot accommodate because of policy or safety rules.
Knowing those details up front is so key then. It means your birth plan reflects the reality of that specific place.
Yes.
Making it a practical tool, not just a wish list that might be impossible to fulfill there.
Precisely. It ensures you're not, asking for something they just don't do or don't have the capability for.
Okay. So once you have that foundation, that knowledge of the options.
Exactly. Then you start writing.
Okay, so you mentioned it can include almost anything.
Almost anything, yes, within the realm of what's actually available and relevant to the birthing process.
Right. Needs to be grounded.
It's tied directly back to that research you did.
And you also mentioned this document needs to be easy for a busy medical team to digest quickly. They can't be reading essays.
Exactly. That's a huge point. Think about it. Nurses on labor and delivery are often juggling multiple patients. Things are happening fast.
Yeah.
They need to be able to scan your key preferences. A common recommendation from experienced L&D staff is keep it concise. Ideally, just one page.
One page. That sounds concise. It forces you to be really clear and prioritize, I guess.
It really does.
Yeah.
Using bullet points, maybe some bold text, or highlighting your absolute top priorities makes it incredibly scannable. You want them to grasp the essential points at a glance, not get bogged down wading through paragraphs when maybe things are moving quickly.
Makes sense. Okay, so let's break down some key areas to cover, aiming for that one-page goal.
Yeah, include the type of delivery you're planning, vaginal plan, C-section, or maybe a vaginal birth after C-section.
Okay, good point.
Oh, and also note any language preferences, or if an interpreter is needed. Super important for clear communication.
Okay, that covers the essential background info. Next section. Your birth team, the people you want with you for support.
Right. This section just lists who you plan to have there, besides the medical staff.
Right.
Could be your partner, maybe family members, a close friend, or a professional birth doula. You'd include who they are and any specific roles they might have planned.
Roles? Like what sort of roles?
Well, for example, if your partner specifically wants to be the one to cut the umbilical cord,
Ah.
or if you're planning to have a professional birth photographer or videographer present, that's important for the staff to know.
Makes sense. And it's probably important to check the facility's rules on how many people can actually be in the room, right?
Crucial. Hospitals and birthing centers almost always have limits on the number of support people allowed, especially during the actual delivery.
Good to know beforehand.
Definitely check those policies ahead of time so your plan is realistic and you don't have any awkward moments trying to fit too many people in.
What about, like, medical students or residents observing?
Good point. If you're giving birth in a teaching hospital, you might be asked if you're comfortable with students or residents observing. You can state your preference clearly here. Yes, no, maybe only certain types.
Okay.
So this section should list who will be there for labor, who for delivery, any special roles, maybe their contact info, and your preference on observers.
Got it. Moving on to labor preferences, how you hope to manage that whole process leading up to the birth. And I guess this section will look pretty different depending on if it's a vaginal birth plan versus a C-section plan.
Exactly. For a planned C-section, many of these labor options won't apply. But for a vaginal birth plan, this is a big section. Pain management is usually top of mind for people. You can list your preferences for both medicated options, like do you know you want an epidural? Or are you open to a local anesthetic or nitrous oxide if they offer it?
And on the flip side, the non-medicated approaches.
List the techniques you plan to use or would like to have available. Things like specific breathing techniques, maybe using hot or cold compresses, massage, and counterpressure. Aromatherapy, if the facility allows it, some don't due to sensitivities. Hydrotherapy is a big one, using a shower or a birthing tub if available. Or maybe meditation techniques.
What about staying mobile, moving around during labor?
Yeah, you can express preferences here too. If you'd like to use labor tools like a birthing ball, a peanut ball, or a squat bar again, confirm they actually have those first.
Right, check availability.
And also, your preference regarding IV lines.
True. What about monitoring the baby's heart rate? Constant versus intermittent?
Yes, you can state your preference. It's important to understand, though, that continuous monitoring is often medically necessary for high-risk pregnancies, or if you get certain medications like an epidural.
Okay, so it might not be a choice in some cases.
Right. But if you're considered low risk and you really value mobility, intermittent monitoring might be an option you can discuss and state a preference for.
And food and drink during labor, is that allowed?
Well, you can state a preference. Usually you can request clear liquids like water, ice chips, maybe broth, just for hydration.
Okay.
Some places might allow light food for uncomplicated labors, but this is often restricted, especially if you have an epidural or if a C-section becomes more likely. It's mainly due to the risk of aspiration if anesthesia is needed quickly.
Safety first.
Exactly. So it's a preference to list, but also one to understand the limitations around.
Okay, that covers managing labor. Now, the delivery itself, preferences for shaping the actual moment of birth.
Yeah, you can include preferences about the environment. Little things like room lighting, do you want it dim or bright?
Setting that vibe again.
Totally. The noise level, prefer quiet. Want to use a sound machine, play your own music.
Okay.
Temperature preferences, if they can adjust it. Your comfort level with photography or video during the delivery. And if you'd like a mirror available so you can actually watch the birth.
Positions for delivery. I know the standard image is lying on the back, but there are others.
Definitely. List your preferred positions.
Lying on your back or maybe on your side, squatting, standing, kneeling. If water birth is an option at your location and that's something you want, absolutely include that. You can also note preferences about physical touch from the care team during delivery, if that's important to you.
And for a planned C-section, are there still delivery preferences beyond just the surgical procedure?
Oh, yes. What's interesting is even within that surgical context, you often still have choices you could express.
Like what?
For instance, you can often request that the surgical drape be lowered for a moment just as the baby is born so you can see them right away. That can be really meaningful.
Or you could ask for monitoring devices, like the pulse oximeter on your finger or blood pressure cuff, to be placed so they aren't directly in your line of sight if seeing them makes you anxious.
Little things that can make a difference.
Exactly. These preferences help personalize the experience as much as possible, even within a more medicalized setting.
So we've mapped out the preferred path pretty thoroughly, but you mentioned earlier roads can have detours, and birth is definitely one place where the unexpected can and often does happen.
Absolutely. It's the nature of it. Things don't always follow the plan, and sometimes unexpected procedures might become medically necessary for your safety or the baby's safety.
Right.
But, and this is really important, this doesn't make the birth plan useless. Not at all.
That's a really key point. So the plan isn't a guarantee, it's not a contract, but it still has value even if things change.
Enormous value. Look, your care team's absolute top priority is always going to be health, safety, and comfort for both you and your baby. That's number one. But by including preferences for potential unexpected scenarios, you're giving them guidance on how you'd like things handled if a changing course is needed. It actually helps you feel more prepared, even for the unplanned bits.
Like having a sort of contingency plan baked into the main plan. What kind of preferences could you include for those unexpected situations?
Well, you might list preferences regarding interventions that could come up during a vaginal delivery, things like episiotomy, or the use of forceps, or a vacuum extractor.
Okay.
It helps the team understand your feelings and desires if these tools become medically indicated possibilities. It guides the conversation.
And what if an emergency C-section becomes necessary, even if you plan for a vaginal birth?
You could state your preference then for who you would ideally like to accompany you to the operating room if the hospital policy allows a support person in that situation. Or maybe preferences regarding medications used during the surgery to help you relax if that's a concern. Thinking through these what-if scenarios beforehand and putting them in your plan actually gives you back a sense of agency, even in moments that might otherwise feel completely out of your control.
That's powerful. Okay, moving beyond the delivery itself, the plan doesn't stop there, does it? It can also cover your wishes for your newborn's first moments and their initial care.
Yes, absolutely. And again, the crucial first step is checking which options are standard practice or even possible at your chosen location. Don't assume.
Got it. Check first. So what sort of first moments, preferences can you list?
Things like preferences for immediate skin-to-skin contact. Who holds the baby first, you or your partner? And for how long, ideally? Delayed cord clamping is a very common request now, letting the cord pulse for a bit longer. And if you have specific plans for the placenta, like wanting to keep it for encapsulation or other reasons, that needs to be clearly communicated because it requires specific handling and hospital procedures.
Right. They need to know that ahead of time. What about the initial medical care for the baby?
Include your preferences regarding the standard newborn vaccinations typically given in the hospital, like the vitamin K shot and the first hepatitis B vaccine.
Yeah.
You can state your consent or refusal or timing preferences here.
What about feeding and soothing?
Definitely. Indicate if you'd like to attempt feeding the baby immediately after birth, if possible. State your feeding plans clearly. Are you planning to breastfeed exclusively? Use formula, donor milk, a combination. And also your preferences regarding pacifier. Use yay or nay, or maybe only under certain conditions.
Any other newborn care details to consider?
Yes. Circumcision preferences, if you're having a boy and have made a decision about that. And bathing preferences. Some parents prefer to delay the baby's first bath for a day or two, or maybe they want to do the first bath themselves.
Wow, okay, it really does cover the whole picture, doesn't it? From your own medical needs all the way through to your baby's first couple of days.
It can be incredibly comprehensive.
How do you make sure this roadmap actually gets used and guides the team?
Well, the main thing is making it easily accessible and super readable. Remember that scannable format?
Yeah, bullet points, bold text.
Exactly. Highlight your absolute top priorities. Make it easy for someone to grasp in like 30 seconds.
Good point. And probably best not to just show up and hand it over cold, right?
Oh, ideally, no. The best approach is to bring it up before the big day. Discuss it with your main prenatal provider, your doctor or midwife, at one of your later appointments.
Talk it through.
Yes. Talk through your hopes, your priorities. This gives them a chance to understand your vision, maybe offer feedback, and clarify anything that might be different from their usual practice or simply not feasible in that setting. It turns the document into a real conversation starter, not just a piece of paper.
Establishes that partnership.
Exactly.
So there you have it. We've really seen how this personal document, your birth plan, it acts as this detailed roadmap covering, well, everything from your medical background and support team, right through managing labor and delivery, navigating those potential detours, and even outlining your wishes for your newborn's initial care.
It's really about empowering you through clear communication, isn't it?
Yeah.
It ensures your healthcare team is genuinely aware of your priorities and preferences. This allows them to support you better and collaborate with you on decisions, rather than just making assumptions about what you might want.
And understanding that it's a plan designed for flexibility, acknowledging that detours can happen, is actually part of its strength, wouldn't you say?
Totally.
Yeah.
Planning for those contingencies helps everyone involved feel more prepared for the journey ahead, whatever twists and turns it might take.
You know, thinking about how much detail and careful consideration goes into creating this roadmap for something as profoundly significant and, let's face it, inherently unpredictable as bringing a new life into the world.
Something for you to think about.